What is going? Oh my God, what's going on, world? How y'all doing? Y'all already know what the deal is. Y'all already know what the deal is. We are doing NCLEX questions. NCLEX questions today here on Tuesday. But of course, I want to know about y'all. I want to know what y'all are doing, why you're going to be here, all that good jazz. Hey, so I have an update. I got so many messages from people saying that, they wanted the 7-day NCLEX course to stay a little bit longer at 97. And I think I'm going to do that. So I'm going to keep it at $97 for lifetime access. So for those that are looking to get the 7-day NCLEX course with all the updates and lifetime access, you guys can check that link out. It is in my bio, so I won't change it. See, I listen to y'all. I'm not a terrible person, you know what I mean? But hey, welcome. If you guys are new here, we are going to be doing NCLEX questions. Hey, I need at least 100 people up in here, so y'all need to like, share, follow, get this algorithm going fucking ape shit so we can get folks over here so I can turn this thing around so we can get these questions going. All right. So like, share, follow. Don't be greedy your whole life. What else? Hopefully everybody had a really good Monday and a good Tuesday. Also, I want to know who you are, where you're from, where you're at in your nursing journey. And if you are not a nurse and you just so happen to stumble inside of this live, we get lit over here. We act up. We make shit happen over here. All right. And so if you're not a nurse or you're not in that profession, what do you do? And hey, what brings you here? What brings you here? All right. So as soon as we get a bunch of people that's over here, we're going to get it on and popping. All right. So what are we doing? What questions? Anybody take their NCLEX yesterday? Anybody take their NCLEX last week? Anybody pass? Let me know, because I will give you your flowers. I'll give you all the love. I'll give you all the support. That's what we do around here. We foster a really good environment. Also, I got these questions off nurseslabs.com. So they're free sets of questions. Anybody can go over there and get them. There is no paywall. There's no nothing. They're free sets of questions. They may not be the best questions. However, these questions, I have seen people have come over here and said that these lives and these questions have helped them. All right. So just think about that. I'm an MSN RN from Ohio, started as a CNA. That's what I'm talking. Started from the bottom, started from the bottom in the entry level of medicine as a CNA. And I love it. That's awesome. International student about to do my NCLEX sunshine. That's what I'm talking about. Bella. Oh my God. Hey y'all, Bella's here. Hey Bella. Welcome back. Didn't see you yesterday, and it was such a great time. What I do? Anyways, we got to get this thing going. All right. Hey, so you make sure you guys like, share, follow. All right. The more likes, the more shares, the more follows, the more that the TikTok algorithm loves the fact that I'm here and doesn't like shadow ban me or anything wild like that. You know what I'm saying? So graduated. And I'll graduate in 9 days with a position in the trauma ER. Shout out to you, Rachel. Hey, go over there and get your learn on working in those trauma ERs. Hey, because we need nurses out here. They need nurses out there. So, we're already underwomaned or undermanned or underpersoned, whatever. Nursing is very short and it always has been for a long time, but COVID really tanked it down. So is it Saida? Did I say that right? Hopefully I said that right. I don't know what's funny. I don't know what I said. So is it Amma says, have completed RN program preparing for the NCLEX. Shout out to you, Amma. Hey, so just letting everybody know, if anybody's looking for an NCLEX review or an NCLEX course that you guys can get, for $97, and you get it for a lifetime with all of the updates, you guys can check that link out in my bio for the 7-day NCLEX course, okay? You get all the updates, you get all the content, you get the reviews that are in there and the ones that are going to be in there as well. So, and they're also for LPNs as well, so make sure you guys go check that out, okay? Hey, so we need 100 people up in here. We need 100 people. Tammy says, I graduated 3 years ago and I'm still struggling to pass the NCLEX. Tammy. Hey, also, y'all, I do one-on-one coaching. I do one-on-one tutoring. I'm like a nurse / NCLEX coach. So if you guys are looking for that, you guys can check that link out in my bio and it'll say NCLEX 101 tutoring. I do that as well. Can I bridge from LPN to BSN? And how long does it take? It depends. And usually when you bridge, you don't bridge to a BSN program. You bridge. No, I take that back. I've seen people that are LPNs that go straight into a BSN program. It all just depends on the program that you go to. All right. Hey, we got 126 people up in here. I'm done running my mouth. Hey, go Longhorns. You know what I'm saying? But about to turn this camera around. We're about to get this thing started. All right. Hey, here we go. Hey, we are about to do NCLEX questions. Okay, Bella, she can. Got you. I got you. I couldn't remember, but that's why I had to stop and say myself. It says question about the NCLEX. What do we need to know for lab ranges, or they provide them? They provide them, but you need to know what happens when they're out of range. All right. That's the biggest thing. You need to know what happens when it's out of range and what you need to do as a nurse in order to fix that. But here we go. Hey, participate. We're doing NCLEX questions. These are both for RNs and LPNs. Okay. Make sure you guys like, share, and follow. Give me all them likes. Hey, we need 10,000 likes. Hey, yesterday we had 118,000 likes. Hey, we need to shatter that, all right? Make sure you guys share, follow, give me all them likes. Don't be selfish. Hey, if you troll my chat, I'm going to ban that ass. Just plain and simple, so don't be rude, all right? I got these questions off nurseslabs.com. They're free sets of questions. Go over there and check those out for yourself. The 7-day NCLEX course, I've heard a lot of people ask. It is now going to stay at $97 for the foreseeable future. You get lifetime access, including all the updated videos and content that will go in there. Also, if you need tutoring or anything like that for NCLEX, yo, I got you. Check that out. That link is also in my bio. All right, y'all, here we go. Question number 1. A 16-year-old patient with cystic fibrosis is admitted with increased shortness of breath and possible pneumonia. Which nursing activity is most important to include in the patient's care? Is it A, perform postural drainage and chest physiotherapy every 4 hours? Allow the patient to decide whether she needs aerosolized medications, place the patient in a private room to decrease the risk of further infection, or plan activities to allow at least 8 hours of uninterrupted sleep. What are we thinking? What are we thinking? Hey, participate. I need answers. What answers do we got, ladies and gentlemen? What are we thinking? What are we thinking? Hey, if you guys are new here, welcome. We are doing NCLEX questions. I got these questions off nurselabs.com. We do NCLEX questions. Now we're going to do NCLEX questions every day. So the more that y'all participate, the more y'all smash that like button, the more we'll do this. But if you guys don't find this valuable, I won't do them anymore. So this all relatively depends on y'all. Okay. Hey, smash that like button. Hey, we need 10,000 likes. We need 10,000 likes. All right. So also, if you're new here, I want to know who you are, where you're from, and where you were at in your nursing journey. Bella, don't make that face. What you mean? Got some A's. We got some C's. Okay. All right, y'all. I'm going to put y'all on a stopwatch, too, because y'all be taking forever. Most importantly is breathing. Okay. Okay. All right, y'all. All right, y'all. So A, yeah, we're about to find out. All right, y'all. Here we go. Here's our answer. Here's our answer in 3, 2, and the answer is A. Airway clearance techniques are crucial for patients with cystic fibrosis and should take priority over other activities. The cystic fibrosis transmembrane was a conductance regulator defect causes mucus to become dehydrated. Secretions in cystic fibrosis are generally thick, sticky, and more difficult to clear. Frequent airway clearance is a mainstay in the treatment of acute exacerbation, as well as an integral part of health maintenance in cystic fibrosis, right? Okay, so ladies and gentlemen, that is what you guys need to know. When you guys are studying for NCLEX, you need to have your content, you need to have Q&A, and you also need to have your rationales. There's no tricks to studying for NCLEX. It's called putting in the work, not being fucking lazy, all right? I'm keeping it all the way real. Hey, if you guys are finding value, smash that like button, okay? Here we go, question number 2. A patient with a pulmonary embolism is receiving anticoagulation with IV heparin. What instructions would you give the nursing assistant who will help the patient with activities of daily living? Select all that apply. Hey, so let me tell you something. I need to see multiple answers that are down there, okay? Is it use a lifting sheet when moving and positioning the patient in bed? Use an electric razor when shaving the patient every day? Use a soft bristle toothbrush or a tooth sponge for oral care. Use a rectal thermometer to obtain a more accurate body temperature, or be sure that the patient's footwear has a firm sole when the patient ambulates. What are we thinking? What are we thinking? Hey, if you guys are new here, welcome. We are doing NCLEX questions. I got them off nurseslabs.com. Make sure you guys like, share, follow, smash that like button. All right. We need 10,000 likes and share it to somebody who you feel may need it, because you never know. They may share it to somebody else who does need it. So just share, follow. Give me all them likes. Also, I got these questions off nurseslabs.com. You guys can go over there and check those out for yourself. Nurseslabs.com. Gabby. All right. Here we go. Here is our answer. Here is our answer in 3, 2, and the answer is A, B, C, and E. All right. All of the other instructions are appropriate to the care of a patient receiving anticoagulants. Risk for bleeding may arise in any condition that disturbs the closed circuit integrity of the circulatory system. Bleeding is the primary complication of anticoagulant therapy and is a risk of all anticoagulants, even when maintained within the usual therapeutic ranges. Okay, so make sure you guys are reading your rationales. Make sure you guys are reading your questions, and make sure you guys get content. All right, those are the three biggest things that you need. All right, here we go. Question number 3. All right, by the way, these are all prioritization, delegation, and assignment type of questions. Okay, prioritization, delegation, and assignment. Question number 3. A patient with acute respiratory distress syndrome is receiving oxygen by a non-rebreather mask. But arterial blood gas measurements show poor oxygenation. As the nurse responsible for this client, you would anticipate a physician order for what action? Is it A, perform endotracheal intubation and initiate mechanical ventilation, immediately begin a continuous positive airway pressure via the patient's nose and mouth, administer furosemide, or call a code for respiratory arrest? Respiratory FX. Okay, what else are we thinking? All right, we got A. Okay, cool. Hey, if you guys are new here, welcome. We're doing NCLEX questions. Got them off nurseslabs.com. Make sure you guys go over there and check those out for yourself. They're free sets of questions. Also, if you are a brand new nurse, they have care plans and nursing diagnosis and all that good stuff for you guys while you guys are in your first, semesters of school, as well as throughout the rest of your semesters of school. Also, I want to know who you are, where you're from, and where you are at in your nursing journey. And if you're not a nurse, what you doing here hanging out? Hey, who came here because I posted that TikTok with a code blue sound? I'm just keeping it real. Here we go, y'all. Here's our answer. Here is our answer in 3, 2. And the answer is perform endotracheal intubation and initiate mechanical ventilation. A non-rebreather mask can deliver nearly 100% of oxygen. When the patient's oxygenation status does not improve adequately in response to the delivery of oxygen at this high concentration, refractory hypoxemia is present. Usually at this stage, the patient is working very hard to breathe and may go into respiratory arrest unless healthcare providers intervene by providing intubation and mechanical ventilation to decrease the patient's work of breathing. Okay. Hey, like I said, these are all prioritization, delegation, and assignment types of questions. Remember, you guys, when you study content, Q&A, rationale, okay? No different. All right. You got to put in that work. All right, here we go. Question number 4. The nurse is caring for a patient with chronic obstructive pulmonary disease. Which intervention for airway management should you delegate to a nursing assistant or a UAP? Is it A, assisting the patient to sit up on the side of the bed? B, instructing the patient to cough effectively? C, teaching the patient to use the incentive spirometer? Or D, auscultation of breath sounds every 4 hours? What are we thinking? What's going on, everybody? If you guys are new here, welcome. We are doing NCLEX questions. Got them off nurseslabs.com. They are free sets of questions. You guys can go over there and check those out for yourself. Hey, participation is the key. We need 10,000 likes. 10,000 likes. All right. 10,000. Yesterday I had 118,000 likes. Let's try to shatter that today. Get carpal tunnel for me. So make sure you guys smash that like button. Make sure you guys share. Make sure you guys follow. You have no idea who would need this information, okay? So don't be selfish your whole life. All right, we got a bunch of A. Well, we have people say A. Got some people that says A, okay? They can't initiate or teach, right? Okay. All right, y'all, here we go. Here's our answer. Here is our answer in 3, 2. And the answer is A, assisting the patient to sit up on the side of the bed. Assisting patients with positioning and activities of daily living is within the educational preparation and scope of practice of a nursing assistant. Some examples of tasks and aspects of care that can be delegated legally to non-professional, unlicensed assistive nurse personnel, provided they are competent in these areas, under the direct supervision of the nurse, including assisting with transfers, range of motion, feeding, ambulation, and other tasks such as making beds and assisting with bowel and bladder functions. All right. Prioritization, delegation. All right. This is a management of care type of questions. Okay. On to the next one. That's what I'm talking about. Dance away. All right, here we go. Question number 5. A patient with sleep apnea has a nursing diagnosis of sleep deprivation related to disrupted sleep cycle. Which action should you delegate to the nursing assistant? Is it A, discuss weight loss strategies such as diet and exercise with the patient? Is it B, teach the patient how to set up the BiPAP machine before sleeping? Remind the patient to sleep on his side instead of his back? Or administer modafinil to promote daytime wakefulness? What are we thinking? All right, what are we thinking? Remember, there are certain things that a UAP cannot do. Remember, as the RN, you are in charge of everyone and everything, to include all the tasks that the LPN does as well as the UAP, okay? If you guys are new here, welcome, welcome, welcome. We are doing NCLEX questions. Got them off nurseslabs.com. Make sure you guys smash that like button. Make sure you guys share. Make sure you guys follow. Those are free sets of questions. These are free sets of questions. Free knowledge, ladies and gentlemen. Free types of knowledge, okay? Also, I want to know who you are, where you're from, and where you're at in your nursing journey. And we're trying to get to 10,000 likes, y'all. Smash that like button. Get carpal tunnel for me. All right, y'all. Here we go. Here's our answer. Here is our answer in 3, 2. And the answer is, there we go. And the answer is C. Remind the patient to sleep on his side instead of his back. The nursing assistant can remind patients about actions that have already been taught by the nurse and are part of the patient's care plan. The right person must be assigned to the right task and jobs under the right circumstances. The nurse who assigns the tasks and jobs must then communicate with and direct the person during the task or job. The nurse supervises the person and determines whether or not the job was done in the correct, appropriate, safe, and competent manner. All right. Hey, keep killing a management of care, delegation. These types of questions are the largest section. They're the largest section on the NCLEX exam. If you're an LPN, it's going to be the coordinated care, right? It's still the largest section on the LPN exam. Okay, here we go. Real quick commercial break. Hey, we are doing NCLEX questions for RNs and LPNs. All right, I got these questions off nurseslabs.com. Make sure you guys go over there and check those out for yourself. Participation is the key, y'all. I need for y'all to be answering, smashing that like button, sharing, and giving me those follows. Okay, don't be selfish your whole life. Get it out there to folks. Get it out there to folks. Hey, if you come into my chat and you start trying to troll or be funny or anything like that, I'm gonna ban that ass. So don't be rude, okay? Also, 7-day NCLEX course. That is my course. That link is in my bio. You get it for a lifetime access with all the updates for $97. Okay, check that link out in my bio. Also, if you're looking for one-on-one coaching for nursing, for NCLEX, all that good stuff, that link is also in my bio. And then at the end, I'm going to do an Ask Me Anything. Hang around for about a good 20 minutes, okay? New grad, take the NCLEX next week. That's what I'm talking about, Abby. Keep that studying going. Keep that momentum going. Hey, don't let your foot up off the gas, okay? Keep going. All right, here we go. Question number 6. After a change of shift, you are assigned to care for the following patients. Which patient should you assess first? Who's going to die if I don't take care of them? Who's going to die if I don't see them? All right. Is it A, 60-year-old patient on a ventilator for whom a sterile sputum specimen must be sent to the lab? A 55-year-old with COPD and a pulse ox reading from the previous shift of 90% saturation, a 70-year-old with pneumonia who needs to start an IV antibiotic, or a 50-year-old with asthma who complains of shortness of breath after using a bronchodilator. What are we thinking? What are we thinking? I'm going to give you guys 15 seconds. All right, got some D's in there. Throw some D's on it. All right now. Hey, if you guys are new here, welcome. We're doing NCLEX questions. Make sure you guys smash that like button. Hey, we're on our road. We're on the road to 10,000 likes. All right. I need for y'all to smash that like button. That's what we're trying to do. All right. We got some people saying C. We got some people saying D. Well, let's find that answer out. Here we go in 3, 2. And the answer is D. A 50-year-old with asthma who complains of shortness of breath after. Keyword is after using a bronchodilator. The patient with asthma did not achieve relief from shortness of breath after using the bronchodilator and is at risk for respiratory complication. These patient needs are urgent. In particular, a patient who is chronically on short-acting beta-2 agonist risks not achieving the same relief from their medication as they once did. This phenomenon is called receptor downregulation. It happens because a portion of the receptors targeted end up being inactivated by the body due to overuse. Okay, hey, you ready for the NCLEX? That's what I'm talking about. Hey, get out here and put in this work. You already know what the deal is. Bella, you already know what the deal is. Hey, so these are prioritization, delegation, and assignment questions, okay? Management of care type of questions on the largest section on the NCLEX, all right? Here we go. Question number 7. After the respiratory therapist performs suctioning on a patient who is intubated, the nursing assistant measures vital signs for the patient. Which vital sign value should the nursing assistant report to the registered nurse immediately? And if you're an LPN, if you were in this situation, what would you report to the RN, all right? Is it the heart rate of 98, respiratory rate of 24, a blood pressure of 168/90, or a tympanic temperature of 101.4? What are we thinking? Now paint the picture. Paint the picture. You're taking care of a patient who is intubated, all right? So what is the most important thing that you need to report to the nurse? VAC sounds like, okay. What are we thinking? Hey, if you guys are new here, welcome, welcome. We are doing NCLEX questions. I got them off nurseslabs.com. Make sure you guys smash that like button. Make sure you guys share and make sure you guys follow. This is what the TikTok algorithm wants. This is what it does. This is how it helps get it out to people who need it, okay? Also, I want to know who you are, where you're from, and where you're at in your nursing journey. And if you're not a nurse, cool. What are you doing here? Are you an RT? Are you an OT, X-ray, surge techs? I get a lot of surge techs that pop up in here. So what are we doing? I'm going to give y'all 10 seconds. We got B, we got C, we got D. Okay, we got D. CC says C. All right, here we go, y'all. Here we go. Abby says D. All right, Abby, here we go, y'all. Here's our answer. Here is our answer in 3, 2. And the answer is D, tympanic temperature of 101.4. Infections are always a threat to a patient receiving mechanical ventilation. The endotracheal tube bypasses the body's normal air filtering mechanism and provides a direct access route for bacteria or viruses to the lower parts of the respiratory system. Remember, this is all part of management of care. Who do you see first? How do we prioritize? How do we delegate? What assignments do we make? This is why this is important. Largest section on the exam, okay? Here we go. Question number 8. An experienced LPN, unlike somebody who is in my chat, I'm sorry. I ain't saying no names. But an experienced LPN under the supervision of the team leader RN is providing nursing care for a patient with a respiratory problem. Which actions are appropriate to the scope of practice of an experienced LPN? What you mean, childish? Stop it. Select all that apply. All right. So auscultate breath sounds, administer medications via metered dose inhaler, complete an in-depth admission assessment, initiate the nursing care plan, or evaluate the client's technique for using an MDI. What are we thinking? We got A, B, E. Okay. A, B, and E. Okay. What else? So, hey, what are the appropriate actions that can be done by the LPN? So this is all about what knowing as an LPN, knowing what you can and can't do, knowing what you can and cannot accept. All right. That is the biggest difference about being the RN aspect, right? There are certain things you can do and that you can't do. Once you understand that, be flying colors. Flying colors. Also, if you're new here, welcome. We're doing NCLEX questions. Got them off nurseslabs.com. Free sets of questions. We're specifically doing management of care type, prioritization, delegation, and assignment. Largest section on the NCLEX. So if you guys are new here, make sure you guys smash that like button. Make sure you guys share. Make sure you guys follow. All right. We need 10,000 likes, and we're almost to question 10. 10,000 likes, y'all. Get carpal tunnel for me. Make it happen. All right, y'all. Here we go. Here is our answer. Here is our answer in 3, 2. And the answer is A and B. All right. Appropriate decisions relating to the successful assignment of care are accurately based on the needs of the patient, the skills of the staff's position, description or job descriptions, the employing facilities, policies and procedures, and legal aspects of care, such as the state's legal scope of practice for nurses, nursing assistants, and other members of the nursing team. All right. LPN to RN. I'm definitely passing it. Hey, I'm just letting you know. Hey, I'm telling you right now, the biggest issue that LPNs have is for the fact that they try to bring real world aspects into perfect world NCLEX. Okay. I'm telling you as a hospital corpsman, aka LPN in the Navy, telling you right now, that was the biggest issue that I had when I was studying for NCLEX, on top of just many other things. All right, here we go. Question number 9. The charge nurse is making assignments for the next shift. Which patient should be assigned to the fairly new 6-month experience nurse pulled from the surgical unit to the medical unit? All right. Based off of the assignments, what patient should I give to the new baby boot nurse? All right. Is it a 58-year-old on airborne precautions for TB, a 68-year-old just returning from a bronchoscopy and biopsy, a 72-year-old who needs teaching about the use of an incentive spirometer, or a 69-year-old with COPD who is ventilator dependent? What are we thinking? What are we thinking? What's going on, ladies and gentlemen? Welcome. Hey, make sure you guys smash that like button. Make sure you guys share. Make sure you guys follow, okay? Need 10,000 likes. Smash that like button, y'all. And make sure you guys participate. Participation is the key to get this to where it needs to go, all right? Also, I want to know who you are. If you're new, who you are, where you're from, where you're at in your nursing journey, all right? Let's foster some good conversations down there in this chat. I'm Bells. Yeah, we know who you are. You're a frequent flyer, Bella. We got you. Here we go, y'all. Here's our answer. Here is our answer in 3, 2. And the answer is A. I'm sorry. The answer is C. See, this is what always confuses me. But the answer is C. A 72-year-old who needs teaching about the use of an incentive spirometer. Many surgical patients are taught about coughing, deep breathing, and use of incentive spirometry post-operatively. The needs of the client must be, competently met with the knowledge, skills, and abilities of the staff to meet these needs. All right. So in other words, the nurse who delegates aspects of care to other members of the nursing team must balance the needs of the client with the ability of those to which the nurse is delegating tasks and aspects of care. So if I'm taking a brand new nurse from a new floor, if I'm taking a brand new nurse who's floating to a new floor, we want to give them the most stable patients, right? We want to give them those patients that have expected outcomes. That's what we want to do. OK. Tomorrow, what, Bella? What are we talking about? RN for 6 years. Shout out to you, Jessica Osborne. Shout out to you, ma'am. Here we go. Question number 10. The high pressure alarm on a patient's ventilator goes off. All right. So paint the picture. When you enter the room to assess the patient who has ARDS, the oxygen saturation monitor reads 87% and the patient is struggling to sit up. Which action should you take next? So systematically, if I'm going from steps 1, 2, and 3, we already hit step 1. What is step 2? Or we're about to start. What is step 1? All right. So do I want to reassure the patient that the ventilator will do the work of breathing for him? Manually ventilate the patient while assessing possible reasons for the high pressure alarm. Increase the fraction of inspired oxygen of the ventilator to 100 in preparation for endotracheal suctioning. Or is it D, insert an oral airway to prevent the patient from biting on the endotracheal tube? What are we thinking? Your lives are so great. I wish I had something when I was coming through school. Look, Jess, I've been a nurse for 3.5 years and I said the same exact thing. So I appreciate you being here. I appreciate you liking, sharing, and following. It actually means the world to me to get all this information out there and to do it for people. So little known fact about me, for those that don't know, I failed my NCLEX 3 times, y'all. I failed it 3 times and I passed it on the 4th. You want to know why? Because I had no time management. I had no accountability. I blamed everybody else for my issue. I didn't put in the work. So I'm trying to tell you, if you guys are studying for NCLEX and putting in the work, you trust and believe me, we'll get through it. And then also believe me, when you start working, no job or no one else gives a fuck about the fact that you failed your exam, because they're going to put that ass to work regardless. Trust and believe me. You can't answer D without evaluating the patient. Okay. Let's see. The answer is B, but correct. Delayed but not denied. Correct. Yep. So the answer is B. Manually ventilate the patient I'm reading what Steph said. Manually ventilate the patient while assessing possible reasons for the high pressure alarm. Manual ventilation of the patient will allow you to deliver FiO2 of 100% to the patient while you attempt to determine the cause of the high pressure alarm. Proper ventilation techniques with the BVM should consider safe ventilation parameters for each individual patient and their conditions. Remember, these are part of management of care. So we're doing delegation, prioritization, and assignment. It is literally part of management of care, which is the largest section on the NCLEX. I took my nursing boards in 1982. Steph, ma'am, respectfully. I was born in 1987, but hey, that's for you. That's for you, ma'am. I appreciate you. Here we go. Hey, so we're doing NCLEX questions, all right? We're doing NCLEX questions for RNs and LPNs. All right, I got these questions off nurseslabs.com. Make sure you guys participate. Wait, I'm not ag. Stop it. Stop it right now, Bella. All right. So, hey, participation is the key. I'm kind of funny sometimes. Steph came in here, let me know when she took boards. I let her know when I wasn't born yet. So, that's all good. Share, follow, give me all them likes. Don't troll my chat. You troll my chat, I'm going to ban you. Like I said, I got these questions off nurseslabs.com. Also, if you were looking for an NCLEX course, I have one, $97. You get it for a lifetime to include all the updates as well. If you're looking for one-on-one NCLEX tutoring, coaching, nursing coaching, check that link out for, also in my bio. Okay, here we go. Question number 11. The nursing assistant tells you that a patient who is receiving oxygen at a flow rate of 6 liters per minute by nasal cannula is complaining of nasal passage discomfort. What intervention should you suggest to improve the patient's comfort for this problem? Is it A, suggest that the patient's oxygen be humidified? That a simple mask be used instead of a nasal cannula, that the patient be provided an extra pillow, or that the patient sit up in the chair at bedside? What are we thinking? Hey, welcome. If you guys are new here, we're doing NCLEX questions. Hey, make sure you guys smash that like button. Hey, we're on the road to 10,000 freaking likes here. 10,000 likes. All right. Hey, I had 118,000 likes yesterday, y'all. It was wild out here. All right. So make sure you guys smash that like button. Make sure you guys share and make sure you guys follow. All right. Also, I got these questions off nurseslabs.com. They're free sets of questions. You guys can go over there and check those out for yourself. And if you're a brand new nursing student, they have care plans, NANDAs, and these questions to help you out and study for school. Super helpful. I used them while I was in school, so I know that they would be helpful for other people as well. All right. I'm going to give you guys 5 seconds. My bad. Okay. Hey, remember, we don't like changing answers, but hey, if you can definitively tell me why you're changing your answer, change it. But if you have any doubt, don't you change it. Usually your first gut instinct is the correct one, all right? So here's our answer in 3, 2. And the answer is A, suggest that the patient's oxygen be humidified, right? So the answer is A. When the oxygen flow rate is higher than 4 liters per minute, the mucous membranes can be dried out. The best treatment is to add humidification to the oxygen delivery system, all right? So, like I said, always about the delegation, prioritization, and assessment, management of care types of stuff, all right? And if you're an LPN, it's all about coordinated care. Essentially the same thing, but knowing what you can and cannot do. You said you're out here daily now. Yeah, look, Joanna, I've been doing it every day since last week, except for Thursday because it was Thanksgiving, right? So this would be I did Monday, Tuesday, Wednesday, Friday, and then yesterday, and then today. So yeah, doing them daily. We got to get folks out here. That live review at school really helped. Hey, I'm glad it helped. All right, here we go. Question number 12. When a patient with TB is being prepared for discharge, which statement by the patient indicates the need for further teaching? So what did my patient say that was incorrect, that requires us to teach them again, reorient them, recalibrate them, let them know they said something wrong, all right? Everyone in my family needs to go and see the doctor for TB. Was that a right or incorrect answer? I will continue to use my ionized until I am feeling completely well. I will cover my mouth and nose when I sneeze or cough and put my used tissue into a plastic bag, or I will change my diet to include more foods rich in iron, protein, and vitamin C. What are we thinking? Hey, shout out to everybody answering down in the chat. Hey, we're doing NCLEX questions. Hey, little known fact about me, y'all. I've been a nurse for 3.5 years. I've worked in ICU, OR, and in PACU. Currently, my home is the operating room, but I worked in a burn ICU, a neuro, and a medical ICU during the second wave of COVID. It was kind of wild out there, but hey, I learned a lot from my critical care days, and now I kind of just do the OR thing. I've been in the Navy for 16 years, but out of those 16 years, 8 of them have been as a master instructor, and the other 13 or ish of them have been as a surgical tech to include an instructor. All right. So a little bit of teaching background. I love to do this. I enjoy being out here giving y'all this knowledge. So I appreciate everybody for being here. All right, here we go. So the answer is B. I will continue to take my ionized until I am completely well. Patients taking this medication must continue the drug for 6 months. The other 3 statements are accurate and indicate an understanding of TB. Okay, so hey, part of delegation, prioritization, and assignments. Okay. That is the section of which it comes from. Hey, you need content, Q&A with rationales, and you have to read the rationales. That is the biggest part about NCLEX, ladies and gentlemen. There are no tricks to this. No tricks to this at all. All right, you got to put in the work. All right, here we go. Question 13. To improve respiratory status, which medication should be prepared to administer to the newborn infant with respiratory distress syndrome? Is it theophylline, surfactant, dexamethasone, or albuterol? What are we thinking? What are we thinking? Hey, if you guys are new here, welcome. Hey, smash that like button. We need 10,000 likes. 10,000 likes, ladies and gentlemen. Also, I want to know who you are, where you're from, and where you were at in your nursing journey. All right. Today is Tuesday, and people are quiet out here. Usually, I got a bunch of folks up in here trying to get this knowledge. I guess Tuesday may not be the day, but make sure you guys make sure you guys share, make sure you guys follow. Okay. Also, I want to know who you are, where you're from, where you're at in your nursing journey. If you are new here, okay. 10 seconds. Man, that chair sounds terrible. User 38 says B. Man says D. Okay. All right, y'all. Here we go, y'all. Here we go. Here's our answer. Here is our answer in 3, 2, and the answer is surfactant, right? Exosurf neonatal is a form of synthetic surfactant. An infant with RDS may be given 2 to 4 doses during the first 24 to 48 hours after birth. It improves respiratory status, and research has shown a significant decrease in the incidence of pneumothorax when it is administered. All right. Hey, prioritization, delegation, and assignment. Okay. You got to know what these medications are for, who's going to need them, and what they're used. Okay. I meant shucks. Oh, okay. It's all good. Here we go. Question number 14. The clinical instructor directed the student nurse to care for a client whose potassium is 6.7. Now, y'all tell me if that is good or not. Which intervention is delegated correctly to the nursing student? Give potassium 10 milliequivalents orally. Give K-exalate 15 milligrams orally. Give spirulactone 25 milligrams orally. Or assess ECG strip for tall T waves. What are we thinking? Shout out to all 42 of y'all in here rocking with me, getting this knowledge in today here on this Tuesday. We're doing NCLEX questions. Like I said, you guys can go and check these questions out. They are on nurseslabs.com. What, Bella? What you mean? Students can give meds under the direction and supervision of the registered nurse. Most definitely. I'm going to say B. Okay, say B, Bella. You said it. You said enough. All right, y'all. 10 seconds. 10 seconds. I think, yeah, Jessica, is it Jessica's? I got you. Yep. Okay, so D is insane. Okay, because D is insane. I got you. All right, here we go, y'all. Here's our answer. Here's our answer in 3, 2. And the answer is B. Give K-exalate 15 milligrams orally. Delegation and supervision. The normal range of potassium is 3.5 to 5 milliequivalents per liter. The client's potassium level is high. K-exalate eliminates potassium from the body through the gastrointestinal system. The right person must be assigned to the right tasks and jobs under the right supervision. Okay? Yeah, so hey, think about K-exalate, right? You can use the same thing for you if you have a patient in diabetic ketoacidosis, right? They have a high potassium with that disease process, right? So we need to get that potassium out of the vessels, right? So say another way to get rid of it is to give them K-exalate. It pushes through the GI tract, bringing the potassium level down. Okay. Hey, so like prioritization, delegation. All right, prioritization, delegation, and assignment. That is what we were going over today. All right, here we go. Question number 15. The patient with COPD has a nursing diagnosis of ineffective breathing patterns. Which is an appropriate action to delegate to an experienced LPN under your supervision, right? Observe how well the patient performs pursed lip breathing. Plan a nursing care regimen that gradually increases activity and tolerance. C, assist the patient with basic activities of daily living, or consult with the physical therapy department about reconditioning exercises. What are we thinking? Shout out to all 46 of y'all in here. We are doing NCLEX questions. Got them off of nurseslabs.com. Free sets of questions. You guys can go over there and check those out for yourself. Also, I want to know if you're new here. If you're new here, not old people, Bella, okay? I want to know who you are, where you're from, and where you're at in your nursing journey, all right? Also, make sure you guys smash that like button. We're on the road to 10,000 likes. 10,000 likes. We're almost there, y'all. Smash that like button. Get carpal tunnel for me. Get carpal tunnel for me. Make it happen. All right, y'all. Here's our answer. Here is our answer in 3, 2. And the answer is A, observe how well the patient performs pursed lip breathing, right? Experienced LPNs, LVNs can use observation of patients to gather data regarding how well patients perform interventions that have already been taught. The scope of practice for the licensed practical or vocational nurse will most likely include the legal ability of this nurse to perform data collection, plan, implement, and evaluate care under the direct supervision and guidance of the registered nurse, okay? Hey, y'all got it. Shout out to all 45 of y'all in here. You graduate in 15 days. Hey, that'll be here before you know it, Bella. You know what the deal is. Bella, you know what the deal is, all right? Here we go. Hey, ladies and gentlemen, real quick, commercial break. Hey, we're doing NCLEX questions for RNs and LPNs. Make sure you guys participate. I'm kind of funny. Maybe not today. Today's Tuesday, and it's cold here in Texas. I don't know why, just because it is. Make sure you guys share. Make sure you guys follow. Make sure you guys give me all them likes. Don't be selfish your whole life, all right? Hey, if you troll my chat, I'm just letting y'all know I'm going to ban you if you troll my chat. So please don't be rude. Please don't act up. Also, I don't gatekeep. Got these questions off nurseslabs.com. I tell everybody this is where I get them from, because this is exactly where I get the questions from, okay? 7-day NCLEX course for a lifetime, ladies and gentlemen. You get this question for $97. And it is both for RNs and LPNs. That link is in my bio. And if you're looking for one-on-one tutoring for nursing, NCLEX, or whatever, check out the bootnurse.com/coaching. And also, I'm going to do an Ask Me Anything after this, where you guys can ask me questions, all right? Here we go. Question number 16. When assessing a 22-year-old patient who required emergency surgery and multiple transfusions 3 days ago, you find that the patient looks anxious and has labored respirations at the rate of 38 breaths per minute. The oxygen saturation is 90%, with the oxygen delivery at 6 liters per minute via nasal cannula. Which action is most appropriate? Oh, somebody got in trouble, y'all. Sorry. Hold on, I'm gonna wait for him, because hey, you already know. Hey, if y'all don't know, I got a toddler. He be acting up, you know what I'm saying? He runs everything in the house, but don't pay no bills. I just don't understand how that ever happens, right? But is it A, increase the flow rate of oxygen to 10 and reassess the patient after about 10 minutes? Assist the patient in using the incentive spirometer and splint his chest with a pillow while he coughs. Administer ordered morphine sulfate to the patient to decrease his anxiety and reduce the hyperventilation, or switch the patient to a non-rebreather mask at 95 to 100% oxygen and call the physician to discuss the patient's status. What are we thinking? Mallory, don't laugh. You already know the deal. You know, hey, you already know how I feel about these kids. Hey, if y'all know how I feel about these kids, go ahead and drop that response. We got C, we got D. Okay, we got some other C's. Okay, what else we got? What else we got, ladies and gentlemen? What else do we got? That's right. Is it Sean? Yeah, ma'am, you know the deal. You know the deal. Straight up. Because, man, I just don't get it. I don't get it, man. I don't get it. Adulthood shouldn't be this hard. Here we go. Here's our answer in 3, 2. And the answer is D. Switch the patient to a non-rebreather mask at 95% to 100% oxygen and call the physician to discuss the patient's status. The patient's history and symptoms suggest the development of acute respiratory distress syndrome, which will require intubation and mechanical ventilation. Patients are mechanically ventilated, guarded against fluid overload with diuretics, and given nutritional support until evidence of improvement is observed. Okay. Hey, you can't say duh. I don't know what you mean. You got it? Okay, cool. We got you. I'm tripping. I read that wrong. Oh, so you didn't RTFQ, Bella? Hey, just for that, tell everybody in the chat what RTFQ is since you decided to not do that. Okay? Yeah, since you decided not to do that. Now you're on punishment. Here we go. Question 17. Which of these medication orders for a patient with a pulmonary embolism is more important to clarify with the prescribing physician before administration? Right? So what is more important to clarify to the person that is prescribing the med? Is it warfarin 1.0 milligrams by mouth PO? Is it morphine sulfate 2 to 4 milligrams IV? Is it Keflex 250 milligrams PO? Or insulin infusion at 900 units per hour? What are we thinking? I didn't see the ARDS. It was blocked. The lies you tell. The lies you tell. It ain't like I just backed it up so you could see it. Hey, shout out to all 40 of y'all in here rocking with me. We are doing NCLEX questions. Shout out to y'all for being here on this Tuesday. I got these questions off nurseslabs.com, okay? Nurseslabs.com, free sets of questions. Make sure you guys go over there and check those out for yourself. Hey, we need 10,000 likes, y'all. 10,000 likes. It was in the corner of the screen, I promise. No, I got you, Bella. You good. Also, I want to know who you are if you're new here. Who are you, where you're from, and where you're at in your nursing journey. Jessica's. That's funny. I don't know why that name is so funny. Jessica's. Says D. Okay. Man says A. All right. Cool. Cool. All right, y'all. Here's our answer. User 90 says C. Cool. Here's our answer, y'all. Here's our answer in 3, 2. And the answer is A. Warfarin 1.0 milligrams by mouth. All right. Medication safety guidelines indicate that the use of a trailing zero is not appropriate when writing medication orders because the order can easily be mistaken for a larger dose, such as 10 milligrams. Right. Yeah, that's what I'm talking about. Hey, so I'm trying to tell you, hey, I had a doctor mess up the medication. And I almost gave it. And I was like, no, I didn't almost give it. When I read it, I was just like, are you sure that you want 50,000 units or 25,000 units for me to push through this patient with heparin? I don't think that's the right number. And they were like, oh, no, I meant 5,000 units. And I'm like, oh, okay. That is actually what we call a near miss. I had to let my charge nurse know about it, my manager know about it. So that way, hey, those are those things that you have to pay attention to, because if you try to give somebody 25,000 units of heparin, they're going to be bleeding from everywhere. You know what I'm saying? So you definitely got to pay attention to what the medication that they're giving, if it's supposed to be for the patient, and the dosage. Okay, here we go. Question 18. You are a team leader RN working with a student nurse. The student nurse is to teach a patient how to use a MDI without a spacer. Put in the correct order the steps that the nursing student should teach the patient. All right. Put it in the correct order. So you have A, B, C, D, E, and F. All right. So what do we got? I'll give y'all about 30 seconds. Okay. Hey, welcome. If you guys are new here, we are doing NCLEX questions. I got them off nurseslabs.com. Make sure you guys participate. Make sure you guys smash that like button. Hey, we are on the road to 25,000 likes. We are on the road to 10,000 likes. 10,000 likes. Make sure you guys smash that like button. All right. Got these questions off nurseslabs.com. I want to know who you are, where you're from, and where you're at in your nursing journey. Brianna, I'm from Michigan. I graduate in 2025. Shout out to you, Brianna. So Brianna, either you're in school or you're about to be in school, one of the two. So congratulations to you. All right. All right, y'all. What do we got? What answers do we got? You guys got quiet on me. What do we got? I'm going to give y'all a little bit more time. CEA. Okay. CEA. Okay. I'm in school right now. Actually, just got out of class. Shout out to you, Brianna. Getting your learning, your knowledge on. I appreciate that. I don't know, man. That's okay if you don't know. That's all right. So we're going to go through it together. You know what I'm saying? So here we go. Here is our answer. MDI. So here's our answer. Oh, look, we got Tatted Mama up in here. All right, y'all. Here we go. Here's our answer in 3, 2. And the answer is C, A, E, F, D, and B. Okay. Those are, what's up? So those are, hey, by the way, I responded back to you, from that original message. But yeah, so it's C, A, E, F, D, and B. Make sure when you guys are going through your questions, you guys are going through the questions. It doesn't matter if you got them right or if you got them wrong. All right. You have to go through your questions, read and review your rationales. Content, Q&A with rationales. That's what you need, plus hard work. There are no tricks to getting through this exam, okay? So here we go. Question number 19. You are acting as a preceptor for a newly graduated RN during her second week of orientation. You would assign the new RN under your supervision to provide care to which patient. Select all that apply. I really got that right. That's what you cannot be doubting yourself. You got to put, you put in this work. You know this stuff. All right. So we have a 38-year-old with moderate persistent asthma awaiting discharge, a 63-year-old with a tracheostomy needing tracheostomy care every shift, a 56-year-old with lung cancer who has just undergone a left lower lobectomy, or the 49-year-old just admitted with a new diagnosis of esophageal cancer. Hey, remember, this is select all that apply. So which one of these patients would you give to the new orienting new grad RN? Surgical tech says A. That's all right, Surg Tech. Hey, you can't come in here and say anything about being a Surg Tech if I've been a Surg Tech before. So we can't make that as an excuse, okay? But shout out to all 37 of y'all in here rocking with me, getting this knowledge in on this Tuesday. I got these questions off nurseslabs.com. Make sure you guys smash that like button, y'all. We need 10,000 likes. As well, share and as well follow, all right? That's the trifecta that TikTok wants. And that's the stuff that I need to get out to people that need this the most, okay? Also, if you're new here, I want to know who you are, where you're from, and where you were at in your nursing journey, okay? Hey, remember, this is a select all that apply question, all right? Select all that apply. So it could be one, could be a few, or it could be all of them. All right, y'all, here's our answer. Here is our answer in 3, 2, and the answer is A and B. A patient who is awaiting for discharge may be stable enough for the care of the student nurse or the new grad, right? The client is the center of care. Okay, that's the same stuff that it always says. The new RN is at the entry point of her orientation. The most appropriate patient to assign her are those in stable condition who require routine care. All right. Hey, remember, prioritization, delegation, and assignment. That is what we are going over today. Remember, those are part of management of care, which is the largest section on the NCLEX exam. Okay. The largest section on the NCLEX exam at like 18 to 23%. All right. The largest section. Remember, management of care, pharmacology, physiological adaptation make the up 44 to 49% of the entire NCLEX exam, okay? So just be aware of that. Here we go, question number 20. Jenna is a nurse from the medical surgical unit of a tertiary hospital. She was asked to float on an orthopedic ward in which she has no prior experience working on. Which client should be assigned to her? So think about it. Same type of concept, right? Same type of concept as a new grad, right? So is it A, a client with a cast for a femur fracture who has numbness and discoloration of the toes? A client with balanced skeletal traction and needs assistance with morning care? A client who had an above the knee amputation yesterday and has currently have a fever of 101.4? Or is it a client who had a total hip replacement 2 days ago and needs blood glucose monitoring? What are we thinking? Shout out to all 36 of y'all in here rocking with me. We're doing NCLEX questions for all those that are new here. Got them off nurseslabs.com. Make sure you guys go over there. Check those out. 7-day NCLEX course, y'all. $97. It's not going to go up for a little bit. So anybody needing the NCLEX review, make sure you guys like, share. You guys go find that. That link is in my bio, but you get all the updates. You get all of the reviews and everything that I'm going to be putting in there, okay? So here we go, y'all. Here's our answer. Here is our answer in. Well, once I get my life together over here. But here's our answer in 3, 2. We know that you're not a nurse. That's okay. You tell us all the time you're a search tech when you're in here. I pick up what you put down. Here we go. And the answer is D, a client who had a total hip replacement 2 days ago and needs blood glucose monitoring. A nurse from the medical surgical floor floated to the orthopedic unit should be given clients with stable conditions as those who have care similar to her training and experience. Okay. A client who is in a post-operative state is more likely to be in a stable condition. Same thing. That's the same person I would want to give to a new grad. And that's the same type of client I would want to give to a new grad. OK, so remember those things when you guys are answering your questions. All right. real quick, hey, we're doing NCLEX questions. Make sure you guys participate. Kind of funny, kind of a slow day today, and that's cool. But I'm still going to give you all this knowledge. Share, follow, give me all them likes. Hey, we need 10,000 likes, y'all. Don't be selfish. Don't be selfish. Hey, if anybody comes in my chat and they start trolling, I'm going to ban them. So, hey, we're trying to foster a good environment down here. All right. So make sure y'all police people, tell them not to be rude. All right. So like I said, got these questions off nurseslabs.com. 7-day NCLEX course, $97 for lifetime access. Also, NCLEX coaching, nursing coaching. Check that out. bootnurse.com/coaching. And I'm also going to do an Ask Me Anything at the end of this. I'm being nice today. You are being nice today. You are. Or be ugly to people that try. Exactly. I don't like that where people are just like, how do you not know that answer? Like, it bothers me. And I tell people, hey, you are in a different stage of your education and learning than somebody else is. Some people people don't even know the basic vocabulary. They have no idea what pulmonary embolism is. You know what I mean? So you got to be mindful of that. You know, you try to foster an environment for everybody. And if you want to be rude, you can fucking kick rocks. You know what I mean? Question 21, which intervention for a patient with a pulmonary embolism could be delegated to the LPN on your patient care team? Evaluating the patient's complaining of chest pain, monitoring lab values for changes in oxygenation, assessing for symptoms of respiratory failure, or auscultating the lungs for crackles. What are we thinking? You're welcome. You're welcome, Tatted Mom, because I don't expect for you to know everything at all. You know, this is why we foster a good learning environment. Where do you see all of the above? What you mean? All right. Hey, if you're new here, welcome. We are doing NCLEX questions. We are doing NCLEX questions. Got them off nurseslabs.com. Hey, we are on the road to 10,000 likes. You should choose all the above. What you mean? I can't. You can't. I mean, your all of the above could be select all that apply, but that ain't it. So, that's your answer? Okay. All right. Well, I won't fight you on that answer, but if it's wrong, you can't be mad at me. LPN can do lung breath sound checks. Okay. I got you, Tatted Mom. I got you. All right, y'all. Here we go. Here's our answer, y'all. Here's our answer in 3, 2. And the answer is D, auscultating the lungs for crackles. An LPN who has been trained to auscultate lung sounds can gather data by routine assessment and observation under the supervision of the RN. Okay. Y'all can, our LPNs can definitely do that. All right, they can definitely auscultate lung sounds to gather that data to tell the RN, hey, I listened to the lung sounds and they sound disgusting. He's coughing up all X, Y, and Z, yada, yada, yada. Okay, that's why that is so important. You got to know who you delegate these assignments to, because I can't be giving LPNs unstable patients. And if I give my LPN a stable patient and they become unstable, they then become my patient and I have to reassign the LPN. Per NCSBN, okay? Here we go, question 22. The nurse plans to care for a client in the post-anesthesia care unit. Which of the following should the nurse assess first? Post-anesthesia, they're coming from the OR, they're coming from the GI lab, they're coming from somewhere. Anesthesia had them all knocked out. So what is the very first thing that I need to worry about? All right, is it respiratory status, level of consciousness, level of pain, reflexes, and movement of extremities? What are we thinking? It's you're telling me B or C. Hey, make a decision and run with it. That's why this is training, right? Make a decision and run with it. All right. So think about it. Post anesthesia. What does anesthesia do? This is for Tatted Mom. What does anesthesia do? It puts you to sleep. What does anesthesia control while you sleep? Okay, cool. Now, if I'm going to the post anesthesia unit, meaning after anesthesia where they recover off of it, what is my number one concern? All right. Here we go, y'all. Here we go. Here is our answer. Tatted Mom, I want you to really marinate on that, okay? Here we go. Here's our answer in 3, 2. And the answer is a respiratory status. Oh, so you've never worked in the PACU, Tatted Mom, and trust and believe me, not saying that they won't leave them, but I can tell you right now, you will have patients in PACU where their O2 saturations will drop and the anesthesia won't be anywhere around. All right. So assessing respiratory status is the first priority. Remember ABCs. General anesthesia and mechanical ventilation impair pulmonary function even in normal individuals and result in decreased oxygenation in the post-anesthesia period. They also cause a reduction in functional residual capacity of up to 50% of the pre-anesthesia value. Okay. You're in same day surgery. Yeah. So same day surgery, you get them. So same, I see what you're saying. So, they come, they check in there, but then they come and then they leave from there. But hey, the number one thing right when they roll out of the operating room, and this is coming from somebody who's a surge tech, OR nurse, and who has worked in PACU, the number one thing that you worry about is respiratory. That is airway. Get them on oxygen. If they need to be on BiPAP, if they need to stay intubated, because we extubate people in PACU as well. All right. Question 23. Nurse Jackie is reviewing the diet of a 28-year-old female who reports several months of intermittent abdominal pain, abdominal bloating, and flatulence. The nurse should tell the client to avoid what? So this is a dietary nutrition type of question, right? So what type of foods could cause abdominal pain, bloating, and flatulence? So which ones do we want to avoid? Is it broccoli, fiber, yogurt, or simple carbohydrates? All right. Shout out to all 39 of y'all. Hey, we're on the road to 10,000 likes. Hey, if you guys are finding value in this, even if you are here every day, smash that like button, y'all. Smash it. Give me the 10,000 likes. I'm going to just take all this in. Yeah, ma'am, just take it all in. It's okay. Just absorb all that knowledge. Absorb all that knowledge. And that's all this is for. My answers are wrong. That's okay, though, because I bet you now, me talking about post anesthesia, you'll always remember it, though. Right, especially if you've never been exposed to this aspect of nursing, right? I would say A. You could say A, but if you get it wrong, do not get discouraged, because it's part of the journey of becoming a nurse or doing anything. Think about it when you were in surge tech school and you had to study for that CST. Trust me, I used to teach that course as well. Here we go, and the answer is B. Broccoli is known to be gas forming, which can lead to bloating and therefore should be avoided. In general, gassy foods are those that contain certain sugars. So fructose, lactose, faminose, and sorbitol, and or soluble fiber. Okay, so broccoli causes gas, right? Broccoli causes gas. Right? Based off of those, right? It says these substances are not digested at the level of the stomach and thus make their way down to the intestines where bacteria break them down. The end result of this breakdown is the release of gas. Okay, so hey, delegation, prioritization, and assignment. Okay, it says I don't go off of everyone else's answer. Hey, sometimes you can follow the crowd. It's not so bad. No, I'm just kidding. Here we go. Nurse Manasa of the Boot Nurse Medical Center, which is great, right? Is planning care for a client who has undergone a colposcopy, right? A colposcopy. Which of the following actions should the RN take first? So what is the very first thing that I should do as a registered nurse when I have a patient that has undergone a colposcopy, right? Discuss the client's fear regarding potential cervical cancer, assist with silver nitrate application to the cervix to control bleeding, give instructions regarding douching and sexual relations, or administer pain medication. What are we thinking? What are we thinking? What are we thinking? So we have a patient that just underwent some type of procedure. What is the number one thing that I want to do first? Oh my God, only one answer? Yeah, there's only one answer. Only one answer. These have not been select all that apply. All right, what are we thinking? Hey, if you guys are new here, welcome. We are doing NCLEX questions. I got them off nurseslabs.com. Nurseslabs.com, free sets of nursing questions that are over there. Make sure you guys go over there and check those out for yourself, okay? 10 seconds. 10 seconds, y'all. Also, if you're new here, I want to know who you are, where you're from, where you are at in your nursing journey. All right, y'all, here we go. Here's our answer. Here is our answer. Bella, I'm just ban you from now on. Make the patient comfortable first so they are more willing to cooperate. Okay, well, let's see. And the answer is B. Assist with silver nitrate application to the cervix to control bleeding. A colposcopy is a procedure to examine the cervix, vagina, and vulva for signs of disease. The priority nursing action when caring for a client who underwent a colposcopy is to assist in controlling potential bleeding by applying silver nitrate to the cervix. All right. So here's the thing. If you don't know what that disease process is, that's okay. This is where you go and you go and you get you some content so you can learn about it, right? But based off of all of the questions, apply what you know versus applying what you don't know. I do know that none of those had anything to do with ABCs except for answer choice B, right? So think about that. Right? ABCs. Do I have to assess or do I have to implement? Is there enough information? Is it physical or is it psychosocial? Right? Physical always takes over psychosocial, right? What is the physical thing? And then after I go and realize that it is a physical thing that I need to do, or a physical thing when it comes to safety of the patient, then I think about my ABCs. ABC's level of consciousness. This is a circulatory issue because we need to control the bleeding, okay? So shout out to everybody that got it right. On to the next one. Here we go. Question number 25. Sally is a nurse working in an emergency department and receives a client after a radiological accident. Which task is the utmost priority for the nurse to do first? So what is the very first thing that I should do first in regards to a CBRNE or a chemical biological, some type of attack, right? Is it decontaminate the client's clothes? Decontaminate the open wound of the client's thigh, decontaminate the examination room the client is placed in, or save the client's vomitus for analysis by the radiation safety staff. What are we thinking? What are we thinking? What is the utmost priority? So what is the very first thing that I should do? All right, what are we thinking? Shout out to all 39 of y'all. Welcome. We are doing NCLEX questions. I got these questions off nurseslabs.com. Nurseslabs.com. Bella, is that answer on here? Huh, ma'am? We got A. Okay, cool. All right, cool. I changed my answer to B. Hey, remember, when you change your answer, you need to be able to 100% with certainty tell me why you're changing. If you don't, and if you can't articulate that, you better not change it. All right. You better not change it. But here's our answer, y'all. Here's our answer in 3, 2. And the answer is decontaminate the open wound of the client's thigh. Decontaminating an open wound is the first priority for this client. This minimizes the absorption and radiation in the client's body. A radiological incident is an event that involves the release of potential dangerous radioactive material into the environment. This release is usually in the form of a cloud or plume and could affect the health and safety of anyone in its path. And Bella, to answer your question, yes. That answer choice wasn't on here though. To answer your question, yes. You want to make sure that they're decontaminated. It doesn't matter what's going on with them. You better make sure they're decontaminated outside before you bring them into the hospital to contaminate the rest of the populace. Not just the people in the ER or in the trauma bay, but the people that are all, to include the staff and everyone else that is inside of the hospital. Okay. Here we go. Shout out to y'all. Hey, real quick. Hey, we're doing NCLEX questions. Shout out to everybody for being here. Make sure you guys participate. Hey, y'all got me to 10,000 likes, so I appreciate y'all. Hey, can we get to 20 though? Let's see if we can get to 20. All right. Hey, make sure you guys share. Make sure you guys follow. Make sure you guys give me all those likes. That is the trifecta that TikTok wants to get the algorithm to the people that need it. All right. So don't be selfish your whole life. Also, you come into my chat and you act a fool and you try to troll, I'm going to ban you. So don't be rude to me or to anybody else that's trying to get their learn on. Okay. I got these questions from nurseslabs.com. They are free sets of questions. Go over there and check those out for yourself. 7-day NCLEX course. It is $97 and it will be that way for the foreseeable future for lifetime access and all the updates. And also you can get one-on-one tutoring for the NCLEX with me at thebootnurse.com/coaching. Those links are in my bio. And I'm also going to do an Ask Me Anything after this. All right. We'll see, how beneficial that is for anybody that wants to do that today. Here we go. Question 26. A client presents to the emergency room with dyspnea, chest pain, and syncope. The nurse assesses the client and notes the following assessment cues. Pale, diaphoretic, blood pressure 90/60 with the respirations of 33. The client is also anxious and fearing death. Which action should the nurse take first? Based off of everything being given to you, what is the next thing? What is the first thing that you should do? Is it administer pain meds, IV fluids, dopamine, or administer oxygen via nasal cannula? What are we thinking? All right, everybody's screaming D. Sunshine says B. Okay. All right. All right. What are we thinking? What are we thinking? All right. Hey, so usually at this point, your assessment, everything is given to you, right? So if we're going to go, assess versus implement, we don't need to assess anything at this point because all of the information is there, right? So at this point, we need to do something, right? We need to do something at this point. All right, y'all. Everybody looks like they've answered. So let's jump on to we'll jump on to the next one, or we'll jump on to the answer. Here we go. Here we go. And 3, 2, and the answer is D, administer oxygen via nasal cannula. The promotion of adequate oxygenation is the most vital to life and therefore should be given to the highest priority by the nurse. When the nurse needs to prioritize patients, Maslow's hierarchy of needs theory is used to decide which patient is to be seen first. A part of Maslow's hierarchy of needs is airway, breathing, circulation, which are physiological elements that are needed for the body to survive and help determine one's level of health. So yes, we definitely ABCs. ABC. Y'all know what the deal is. Larry Hoover. Girl, stop it. Hey, what's up? Larry Hoover's in the building, y'all. All right, y'all. Appreciate you. Here we go. Here's question number 27. Hey, Hoover, you kind of missed it. You kind of missed it all. All right, we're almost to the tail end. Almost to the tail end. All right. Here we go. Question number 27. The nurse enters a room and finds a patient lying face down on the floor and bleeding from a gash in the head. Which action should the nurse perform first? Hey, what should I do? What is the very first thing that I should do after that? Determine the level of consciousness, push the call button for help, turn the patient's face up to assess, or go out in the hall to get the nursing assistant to stay with the client while the nurse calls the physician. What are we thinking? What are we thinking? Shout out to everybody in here. We are doing nursing questions and NCLEX style questions. I got them off nurseslabs.com. They are free sets of questions. Make sure you guys go over there and check that out. Also, smash that like button, y'all. We're trying to get to 20,000 likes. 20,000 likes, ladies and gentlemen. 20,000 likes. All right, and make sure you guys share and make sure you guys follow. That is the trifecta that TikTok needs. All right? So, also, if you're new here, I want to know who you are, where you're from, and where you're at in your nursing journey, all right? I'm going to give y'all 10 seconds. Everybody's saying A. Kamal says A. Okay. Jessica Kurz says A. All right, y'all. Here we go. Here's our answer. Here is our answer in 3, 2. And the answer is A. Determine the level of consciousness. Assessing the level of consciousness should be the first action when dealing with clients who might have fallen over. The initial step is to evaluate for reactivity using objective measures. Address the patients verbally, progress to light shaking, then progress to more intensive mechanical stimulation. So if you see somebody passed out, hey, sir, can you hear me? Hey, are you with me? Yada, yada, hey. And if they can't do that, then you go on to something else. All right. Then you go on to something else. All right. Here we go. Question number 28. You are admitting a patient. Man, I don't know what happened there. You are admitting a patient for whom a diagnosis of pulmonary embolism must be ruled out. The patient's history and assessment reveals all of these findings. Which finding supports a diagnosis of pulmonary embolism? All right. Is it a patient was recently in a motor vehicle accident? A patient participates in an aerobic exercise program for 6 months. The patient gives birth to her youngest child 1 year ago. A patient was on bed rest for 6 hours after a diagnostic procedure. What are we thinking? Shout out to all 41 of y'all in here rocking with me. We are doing NCLEX questions for RNs and PNs. I got these questions off nurseslabs.com. Make sure you guys go over there and check that out for yourselves. Also, I want to know who you are, where you're from, where you are at in your nursing journey. We are doing NCLEX questions, so shout out to everybody that is here, that is participating, right? D, caused blood clots. Okay. All right, what else are we thinking? We got A, we got D. Okay. Hey, we're on the road to 20,000 likes, y'all. I think I'm thinking in too deep into this question. You probably are. Because it could be A, C, and D. Yeah, but I only want one answer. Think about what is the most, right? Which one, hey, like, oh yeah, most definitely that'll do it. These other ones can do it, but this one most definitely will do it. All right, here we go, y'all. Here's our answer in 3, 2, and the answer is A. The patient was recently in a motor vehicle accident. All right, here we go. Patients who have recently explored or experienced trauma are at risk for deep vein thrombosis and pulmonary embolism. PE remains relatively common after trauma and occurs in the absence of lower extremity or spinal fractures. Although PE is usually thought to occur between days 5 and 7 after injury, data suggests that it's more of 37% of pulmonary emboli occur early. All right. So, hey, think about that. Bed rest is only 6 hours. Yeah. So in order for you to really develop pulmonary embolism after a procedure, bed rest for 6 hours ain't going to do it. You're going to be thinking about prolonged bed rest. And depending on what type of procedure it is, right? They want you to get up. You got to get up. You got to get up. Not me reading 6 days instead of 6 hours. Oh, 30. User 38. Sir or ma'am. Hey, RTA, we got an RTFQ. We got to read the fucking question, all right? I mean that in all sincerity, and I mean that in nothing but love, because that's the truth. I had a problem reading the question, so I always had to say, hey, read the fucking question, bro. Read the question. Slow down. Slow down and read the question. Damn, I thought it was 6 days too. Bella, that doesn't surprise me. That doesn't surprise me at all. I'm just keeping it a stack. All right, here we go. Question 28. You are assigned to provide nursing care for a patient receiving mechanical ventilation. Which action should you delegate to an experienced nursing assistant? Right? So, UAP, what can they do? All right. Is it A, assessing the patient's respiratory status every 4 hours, taking vital signs and pulse oximetry reading every 4 hours, checking the ventilator setting to make sure that they are prescribed, and or D, observing whether the patient's tubes need suctioning every 2 hours. What are we thinking? What are we thinking? Shout out to all 40 of y'all in here. We're doing NCLEX style questions for both RNs and PNs. Got these questions off nurseslabs.com. Make sure you guys go over there and check those out for yourself. Hey, we're trying to get to 20,000 likes. 20,000 likes. Make sure you guys share. Make sure you guys follow. Make sure you guys like. Hey, don't be selfish your whole life. Hey, I'm over here giving all this knowledge. I need for y'all to get carpal tunnel for me. CNA can do vitals. Yes, they sure can. CNAs, patient care techs, UAPs, whatever you want to call them. On NCLEX, they're called unlicensed assistive personnel. Don't know if you know that or not. I'm just saying that just to generalize it. So, but here we go, y'all. Here we go. Here's our answer. Here is our answer in 3, 2, and the answer is B. Taking vital signs and pulse oximetry readings every 4 hours. Right? Yeah, CNA. Is it Rach? Oh, snap. Rach is here? Oh, okay. I don't know why. I was thinking about your name just like the other day, and I was like, man, she said Rach. Rach. All right, cool. I got it. Here we go. So nursing assistant the nursing assistant's educational preparation includes measurement of vital signs, and an experienced nursing assistant would know how to check oxygen saturation by the pulse oximetry. Okay. That is part of their scope of practice. That is part of their scope of practice, right? What should be taken every 2 hours? It depends on whatever the doctor's orders are. That's kind of a vague statement, Faye. You got to kind of give me a little bit more context. That way I can answer, or that way somebody else in the chat can answer you, okay? But shout out to all y'all for getting that answer right. Shout out to those 12,000 likes. Here we go. Question number 30. You are caring for a client or a patient with emphysema and respiratory failure who is receiving mechanical ventilation through an endotracheal tube. Okay, to prevent ventilator associated pneumonia, VAP, which action is most important to include in the plan of care? Right? So based off of somebody who's intubated, and to prevent them from getting pneumonia, what is the most important thing that you need to have inside of the care plan? Order antibiotics as scheduled. Hyperoxygenate the patient before suctioning, maintain the head of the bed 30 to 45 degree angle, or suction the airway when coarse crackles are audible. What are we thinking? What are we thinking? So, Faye, don't read so much into that, right? So there on a standard level, there's only a specific amount of vital signs. You have your heart rate, You have your pulse ox. You have your blood pressure, heart rate, pulse ox, blood pressure. Oh my God, I'm over here losing the rest of them. Heart rate, blood pressure, temperature, right? UAPs, CNAs, patient care techs, they can do that, right? Those are vital signs, right? Now, what they're supposed to do is if those vital signs are not within the normal range, they, regardless, are going to report their findings to the nurse, to the RN. That's exactly what they're going to do. All right. And at that point, if they're out of range, the RN is then going to assess the patient to figure out why they have a temperature or a blood pressure that is out of range. Okay. All right, y'all. I'm going to give y'all 10 more seconds. 10 more seconds. Think about it, user 71. Think about it. Hyper. What does hyper mean? Yeah, you're welcome. Think about hyper, right? So we're going to break that question out. Hyper and then oxygenate, right? So hyper means what? Up or down, or, above or below, hyper, up or down. Oxygenate, giving oxygen. So do I want to give them a lot of oxygen? Or do I want to get them a low amount of oxygen? There you go. Well, Rach, you already know what the deal is. All right, here we go, y'all. Here's our answer, y'all. Here is our answer in 3, 2. And the answer is C. Maintain the head of the bed at 30 to 45 degree angle. Research indicates that nursing actions such as maintaining the head of the bed at 30 to 45 degree angle decreases the incidence of VAP. Right? Position the patient is important to prevent pneumonia, right? Because I'm not having all that nastiness just sit stationary. You got to keep them up so they can get full expansion of the lungs, right? These actions are part of the standard of care for patients who require mechanical ventilation. Proper positioning and encouraging early mobility of mechanical ventilated patients aid in the prevention of VAP. Shout out to all y'all that got that answer right. Shout out to everybody that hung out and got the answer right. Appreciate everybody. Hey, if you're new here, we're doing NCLEX questions. So got them off nurseslabs.com. Make sure you guys go over there and check those out. But ladies and gentlemen, that is it for the questions tonight. You got it wrong. Oh, well, I learned a lot though. That's okay though. As long as you learn something, I don't care if you get it wrong, but what I don't expect for you to keep getting them wrong. That's the whole point about practicing, right? That's the whole point about practicing. Okay. Hey, but I appreciate everybody hanging out. I really do. Thank you for your participation. Usually I have a lot more people in here, but it didn't matter. If I had one person in here, I would still give you guys value. It doesn't matter who's in here, okay? I didn't have to ban anybody. I didn't have a lot of people in order for me to do that. Also, nurseslabs.com, still the same place where I'm getting these questions. 7-day NCLEX course. It is now at $97 and it's going to stay at $97 for the foreseeable future, okay? Also, if you're looking for NCLEX coaching, one-on-one tutoring or anything like that, you guys can check those links out in my bio. Okay. Is it, ma'am? I don't even know how to say your name. Is it Mammy? Mamie? I'm gonna fuck it up. I'm sorry. I don't mean to be rude, but I'm gonna mess your name up. But I'm gonna turn this camera around. That way you guys can see my lovely face, and then I'll hang out for a little bit. Hey, first of all, go Horns, right? So, hey, welcome. Oh shit, I don't know what I did. But yeah, what's going on, everybody? Today is Tuesday. Today is day 2. We're doing stuff every day, right? We're doing stuff every day. But I want to know what y'all are doing. Hey, yesterday I had 1.2 thousand people. I had 1,200 people. Fuck, obviously I don't know how to say that, right? But I had 1,200 people in here at peak, and I had 118,000 likes, right? And then today I only have like a max of I think I had 200, and then as soon as I started, everybody was like, fuck you, I gotta go, right? But I appreciate everybody that hung out. Hey, if you guys are new here, you guys don't know me, I'm Kevin. I'm a nurse. I've been a nurse for 3.5 years. I specifically have worked in 3 different ICUs. I've worked in PACU as well as I work in the operating room. I've been in the Navy for 16 years. Within those 16 years, I've been deployed twice, one to Afghanistan, one to Guantanamo Bay. As well as I'm a master instructor in the Navy. I've been teaching for 8 years. I was a surgical technology instructor for 3.5 years, also a clinical coordinator for that. I'm a trauma nurse instructor. So I've taught a whole bunch, and I've been doing this TikTok thing, religiously for the last couple of months, and I love it. I love being here. I love teaching you guys. So what questions do you guys have? Do you cover computations to sometimes? What do you mean, Rach? Computations to what? What do you mean? Hey, and if you guys are finding value, make sure you guys smash that like button, okay? Hey, so Black Friday, Cyber Monday is over. I had a lot of people reach out and ask if I could keep it at $97. And I was just like, you know what? I'm going to keep it at $97. So I kept it at $97, and it's going to be that way for the foreseeable future. But what you guys get in the 7-day NCLEX course is you got like right there. Essentially, there are 2 separate reviews that are in there. There's one review that is already in there, and there's one review that is currently in production. Y'all, I'm trying to tell y'all, I have been sitting in this chair all day recording content, trying to get it up in there because I want to provide value to all you guys. Okay. But what questions do you guys have? Like, do you post questions about computations? Like, what computations though? Like, am I missing something? Any advice from Farm? I'm taking it next semester. So, oh, math meds. You mean dosage calculations? Oh, they call it computations? Rach, where you're from or where you're at? Okay, I'm thinking with computation. I'm so confused. I'm confused most with converting to... Oh, dosage calculations with conversions. Oh, Canada. Okay. Ma'am, I'm picking up what you're putting down. So to revert back to so essentially you just need to know like, hey, like 1 gram equals, 1,000 milligrams, 1 microgram equals like 100 milligrams, so on and so forth. So the biggest thing for that is just knowing the honestly with that, it's just practice. Like I will be honest with you, I am not the best person when it came to dosage calculations, but honestly, in reality, that is all about practice. Practice. As a matter of fact, I'm actually about to drop a pharmacology ebook. And the pharmacology ebook is going to, right now it's about at maybe 100 to 200 pages. But that pharmacology ebook is going to go over all the important things, even ones that you need in nursing school. They go over all the important drugs that you need to know within the certain categories. Also talks about dosage calculation. And I'm going to be putting that out here within the next couple of days. I just got to finalize it, make it look pretty and, make it look presentable. Obviously, I don't want to just be like, hey, here you go. Here's this mess while it's not all put together. OK. Any advice? So Jessica Kerr's pharmacology, family name, suffixes. Right. You need to know you need to know your prefix, your suffix. But you need to know what family it falls under. Dimensional analysis helped me with conversions for yeah, absolutely. Dimensional analysis. Hey, hate it or love it, it works. Hate it or love it, it works. But Rach, you're okay. Like I said, I'm picking up what you're putting down. No problem at all. But yeah, so those conversions. You definitely just have to practice them. Okay. I would definitely look on maybe like Farm D on YouTube. Also Khan Academy on YouTube as well. That they have some really good stuff that's out there. So what other questions do you guys have? Hey, so another little fun thing about me is that I failed my NCLEX 3 times. If you are new here and you did not know that, I failed my NCLEX 3 times, y'all. 3. And the one thing I'll tell you is that nobody cares. Nobody cares that you failed it. No job will ever care. They'll never ask you. No supervisor will ever care. They'll never ask you. The only person that care and want to bite on is you. Trust and believe me, you know who else is not going to care? The people that you are trying to compete with, aka the other girls and guys that are in your cohort. I'm trying to tell you. First time I took the exam, 75 questions, failed. Second time, 265, failed. Third time, 106, failed. At that point, bro, what the hell is going on here? Why am I not doing so well, right? Hey, look, and you know what it took? It took me getting a mentor. Somebody who had walked the same line as me, which is another reason why I created my coaching, right? Is because I understand, even if you want to pass the first time, I understand exactly what you are going through. I don't mean to give y'all the finger, you know what I'm saying? But I understand what you're going through and I understand how tough it is. And we all go through things in our life that prevent us from getting over that hump or to getting to Mount Everest. You know what I mean? It happens. All right. But I'm here to tell you, I'm your mentor. I'm here for it. So you come to these lives if they're helpful. Cool. If you get the course, love it. That's helpful for you and it's helpful for me. Also, you want the coaching, you get this, but you get it one-on-one. You get it personal. This is the things that you get. So what I'm trying to tell you is that nobody cares if you fail. Nobody cares. But it is a part of your journey if you do. I love my nurses that pass on the first time, but I have a special place in my heart for those that take the exam multiple times. All right. So what question? Let's see what else y'all got on here. What's the best textbook for NCLEX revision with answers? Faye, what do you mean NCLEX revision? Like you're going to take it again? Is that what you mean? You can never go wrong with the Saunders book. However, if you want an NCLEX review, you can check out my 7-day NCLEX course, right? You get that unlimited. You get full access to that. And I also, I'm dropping content in there. Right now, there's 55 videos, and I'm projected to put in well over 150. All right. So I'm trying to tell y'all can get in there. Y'all definitely can get y'all that knowledge. I failed my NCLEX, my first NCLEX too. It's always near passing. Rach, are you still failing? Thank you for this words of encouragement. Rach, I got you. You're no problem. My teacher is doing a review class, but I just bought your NCLEX review. Should I do her class as well? Why not? Get the knowledge. You got both. You got both. But then here's the thing that you got to realize too, beautiful. They could do the review and you could not be feeling it. They could start teaching you wrong and you could be like, or they could start teaching you stuff that you're just like, that don't make sense. Or maybe their delivery is not there. You know, there are plenty of reviews out there and not all reviews are your cup of tea. Okay. There's a reason why I literally spent a total of $3,000 on board application, on Pearson VUE, and on study material, so y'all don't have to, right? That's why I created that review. But it may not be, things may not be your cup of tea. So keep both. Definitely keep both. But Rach, you're welcome for the encouragement. I'm here for it all the time. I am new at the States. Oh, so you're new here in the States. Okay, I got you, Faye. I'm tracking. I'm picking up what you're putting down. The Saunders book is cool. However, I'm a visual learner, and I like the fact that things are in PowerPoint presentation where somebody's talking to me and giving me and dropping gems, right? As well as, ebooks incorporated with that. Spot on. So it all just depends on you and what type of learner that you are. Rach said, I read the whole Saunders book, but I think better to read and more practice. So Rach, here's another thing to think about too. Think about what type of learner are you? And these are videos that are actually going to go up inside of my course, but think about what type of learner that you are. Okay. Are you a visual? Are you auditory? Are you kinesthetic? Visual, meaning like, you like somebody to do PowerPoints, or you like, pictures and blah, blah, blah. Like, are you visual like that? Are you auditory? Like, do you like podcasts? Or do you like, listening to audios? Are you kinesthetic? Like, are you hands-on? However, with your hands-on aspect, can't do anything with that in regards to NCLEX, right? But still have to bring that into your learning as well. Also, are you a read-write? So do you like to read PowerPoints and read books and then try to write down the notes and try to, write out your own book, Or are you a combination of a few or all of them? That's where you first got to understand that. Once you understand what type of learner that you are, it's so much easier for you to retain the information. I realized you can't put a book in front of me. I have to use a book as a reference, right? I have to use a book as a reference. But if you give me a PowerPoint and a presentation and you start showing me little things and you start talking, I can see it. I can hear it. And now if I need to take notes, I'm going to print out that PowerPoint and whatever you say, I'm going to write. And then if I need to do more research, if I start getting stuff wrong, I'm going to open up the book and I'm going to refer to it. But you're never going to see me sit down and be like, start looking through a book. It can't happen. The fastest way to put Kevin to sleep is to put a book in front of him. That's why I have books, but I listen to audiobooks because that's how I retain my information. That's smart. I should start watching video. That's what I'm saying. That's exactly what I'm saying. So that's another thing, Rach, is what I was saying is that with the 7-day NCLEX course, every single content video comes with a download that you can print, AKA the same PowerPoint that I go through. You can print it off. You can take notes as I'm going through the lecture, right? As a matter of fact, I'm going to show you exactly what I'm talking about right now, because some people are just like, what does it come with? So on and so forth, right? So once you go to the website, that link is in my bio. Right there. That link is in my bio. Okay. So once you get there, this is what it's going to look like. And like I said, for the foreseeable future, $97. That's what you're going to get. It's not $347. Eventually it will be, but it's not. But it's $347. You get the free updated content. You get monthly updates. You get the Facebook page, over 100 videos, which are going in there, the 7-day review, as well as the new generation NCLEX review, right? Now, inside of here, now let's go to dosage calculations where you were talking about accumulation, right? I got you, right? I have 18 videos right here, 18 videos, but let's go to dosage calculation. You see this download right here, this one download. This one download is the exact PowerPoint that I go through, right? The exact PowerPoint that I go through. I give you an introduction. We talk about the rules of dosage calculation. We talk about dimensional analysis, cross-check calculations, different ones. And then look, here's some conversion charts, right? Talk about milligrams to grams. You want to divide the value of milligrams by 1,000, and you'll hear me talk about it. You'll hear me talk about it, right? Talk about volume, right? Something else that you were asking about, right? What else? We talk about weight conversions, time conversions, right? We talk about that as well. And then we have some other ones. We have ones where temperature, look, the units of measurement. So we have our 1 gram equals 1,000 milligrams, 1 kilogram equals 1,000 grams, so on and so forth, right? And then we have some examples applying conversion to drugs, right? So this is one, here's one, there's an example, right? And then we go through here, we talk about with PO meds, the conversions with for dosage for PO meds as well. I also have them in here for IV push and also IV drip rates, right? We were just talking about IV drip rates as well, right? So, like I said, you get this video. Also, we talk about injections. This is a 15-minute video, a 15-minute video rate that you can go through, that you literally can go through and then go back. And then you have a printable download right here. So if I hit download, you can download dosage calculation, and I have it right here, right? So I'll click that. We'll click that. And then boom, here's the dosage calculation. Here's the same PowerPoint that we just went through. So guess what? Print it off. We do it together. And by we do it together, I mean we go through the lecture together, right? So that is with dosage calculation. And then if you come down here we have the new generation NCLEX, y'all, the new generation NCLEX review, right? This is based off of the updates that they did. This is based off of the updates that they did starting April 1st of this year, okay? So anybody that's interested in the 7-day NCLEX course, it is available. That link is in my bio. It's going for $97. Okay. It's going for $97. Hey, and also you're going to get all of the updates. And right here, here's the question I get asked all the time. Is your stuff NGN? Yes, it most definitely is. If you guys recognize this, to me, this looks like a bow tie. Right? Looks like a bow tie question. This is the bane of everyone's existence, apparently. Like they do not like a bow tie, right? But right here, we have our case study. You have the information that you need, right? They give you the information based off of you. If you were a nurse working in a hospital and you had to accept a report or a patient, you had to accept a report and now you have to take care of this patient. This is what you get, right? You have a client who has crushing chest pain radiating to the left arm. Boom. Already in my head, I'm just like, all right, cool. I'm thinking of an MI, right? Already with those signs that are already given to me, right? And then you get vital signs, right? And then you go to the question and then they ask you, here's your question. Here's your question. The condition based off of the information that was given to me in the case study, the condition most likely being experienced is what? A panic attack, pericarditis, a myocardial infarction, or a pulmonary embolism, right? And so based off of that information, we realize that it is a myocardial infarction. And these are the type of questions that I go through, right? And also, with the new generation NCLEX review, I go through 100 questions. That's 4 hours worth of content. No video is longer than 30 minutes. Why? Because who in the world wants to sit here and listen to somebody talk for hours on end, even if you have the ability to pause? Who wants to do that? Nobody. And I'm telling you, as somebody who has worked formally on a podium, actively teaching to students, I'm trying to tell you, after me talking for about 50 minutes, people are gassed. They need to get up, take a break. So why not cut that time down to 30 minutes? Give me 30 minutes, get your knowledge in, and then go on about your business. All right. So hopefully everybody got some good knowledge based off of that. You guys can see what the NCLEX course has. Like I said, it's $97. You guys can check that out. That link is in my bio. Also, if you're looking for one-on-one coaching, hey, listen, I bring the heat. I bring the heat with coaching. All right. So if you guys are looking for that, that link is also in my bio. Also coming down the pipeline, which is I had asked everybody yesterday, was who would be interested in trying to make some shit happen in 30 days? Who in here would be interested in making some shit happen in 30 days? AKA being in a small group setting with me, going over NCLEX style questions, right? Not only going over NCLEX style questions, going through some mentorship, right? Going through where you want your career to go, right? Giving you a study calendar. Everybody has an individualized one, but helping you create one for yourself. Going through a study tracker, a progress tracker, so that way you know where you fall and how you can better hone in on your studying. Helping you with your time management so you can start trimming the fat. You see what I'm saying? Who would be interested in that, which I call making shit happen? Who would be interested in that? I work 10 p.m. to 6:30 and I go to school in the evenings. I find myself struggling to study. How can I use your time management? How can you use your time management skills effectively? So you work night shift. Now that, ma'am, is where it is difficult. So even though you work night shift, we all still have the same 24 hours in a day, right? So here's something I would recommend. You work 10 p.m. to 6:30. What are you doing at 7 o'clock? And by 7 o'clock, I mean 7 p.m. before you go to work. What are you doing? Or what are you doing at 6, right? And then you also have to think about, hey, I have a family, I have children, I have all these other responsibilities that I have to do, right? So you also have to account for that. So the one thing I'm going to tell you is write it down. Write it down. I know that you bought the course. So if you go into the lecture where it says time management, I actually put a link in there where it says click so you can see an example of a time management sheet. It's very, very basic. It was something that I had came up with, but you can expand upon that as much as you possibly want. Like, I mean, when I was in school, when I was studying for NCLEX, it was hour by hour, 6 a.m. from 6 a.m. all the way to 6 a.m. the next day. That's exactly that. I had sleep. I mean, even to the point where I was going to the bathroom. You have to have time management, especially with the fact that you work nights and that you go to school in the evenings, right? So if you go to school in the evenings, right, you aren't going to be going to school forever. Now you got to think to yourself, what are you doing before you go to work? I don't know the intricacies of what you do, right? With coaching, this is where it gets a little bit personal. And then I start asking you all kinds of stuff. We write some stuff down, we move some stuff around, and we see if that's feasible. And then we move things around for it to better suit you. All right. But time management, you most definitely got to get down, right? Hey, maybe wake up 2 or 3 hours early, before you go to work, or, don't go out to have breakfast, or, get you a good hour of studying in after you finish your 6:30 shift. I say, trust me, I understand what it feels like to work nights. I used to work nights and it sucks. As soon as you get home, you want to take a shower and you want to go to sleep. I understand that. So I 100% understand that. But hey, who else? Hey, that was a good question, beautiful soul. But hey, what other questions do you guys have? What other questions do you guys have? Today has been a slow day, y'all. Hey, but today has been a slow day. But let me tell you, I am still here for it. I am still here for it. Right now, I have, just for management of care for the 7-day NCLEX review, the review that's inside of the 7-day NCLEX course, it's like 4 hours of raw footage. 4 hours of raw footage that I have to edit down and put it into 30-minute videos for y'all. 4 hours, right? But I enjoy doing it. I enjoy doing it because I know that this is going to be beneficial for somebody, okay? So if you guys are new here, welcome. If you guys are finding value and you guys are already in here, smash that like button. We do NCLEX questions 5:30 Central Standard Time. We're starting to do them every day. So we're going to be here tomorrow to do the same exact thing. Well, tomorrow might be a little bit late because somebody in my house has an appointment. I don't know if it's me or if it's somebody else, but we do NCLEX questions every day. Okay. And then after that, we do an Ask Me Anything all the time, any type of question that you guys have. And then I answer as best to my ability. Okay. So what other questions do you guys have? Is there anybody out there that has any questions? Anybody out there? Ernisha. Okay, Ernisha, I ain't seen you in a minute, girl. Ernisha says, what is a good starting wage for a new grad with no experience in a low cost per living state? Oh, well, I can tell you right now, the lowest wage for a nurse in the United States per state is Mississippi. They pay new grads on the very low end. But in California, I want to say they start brand new grads out at like $40 or $50. Granted, you got to realize that you live in California. So $40 or $50 an hour to the average of like $80 to $90 an hour or whatever that they make in California is crazy, right? So a good starting wage, honestly, it really does depend on the state. It really does depend on the state. In Texas, at one point, it was like $25 an hour. When I started, I was making $25 an hour. But now, on average, they start new grads out, I think, around $30. So like a $5 increase, which still ain't shit, especially with how inflation has happened. You know, it's like they were trying to give us Black Friday sales on TVs and we needed Black Friday sales on groceries. So, there's that. What's a fair range for Ohio? Arnisha, I don't know. I personally don't know because I don't live in Ohio. What I would recommend is just doing a little bit of research. Go to like salary.com or whatever those websites are and check out the happy median, right? As well as ask other nurses that are working in the field what the average price is or what the average salary is, right? So hell, even the salary can change even by city within your state. Like I live in San Antonio, but if you go to Houston, they pay nurses a little bit more because, Houston is more expensive. Same thing with Austin and same thing with Dallas, right? So those are the spots. Look on Indeed in that area and they'll have an estimate. Yeah, for sure. Like Indeed, salary.com. There's a couple of other ones. There's a couple of other websites out there where you can kind of, not pick and choose, but you can kind of bounce off of one another, right? So that was a good question. What other questions do you guys have? Hey, for all the 15 people that are sitting here rocking with me, first of all, I appreciate you guys rocking with me. If you guys still find value and you guys are still here, smash that like button. Give me a little something. But what other questions do you guys have? I'm so impatient. I just want to be an MP. Look, okay. You can be impatient all you want, but you got to go through the process. You and I both know that. You got to go through the process. And look, you got to go through the process. That's just how it is. When it comes to your NCLEX review, do you need to go in order of your lesson plan? So you need to go in order all the way until you finish the review. After that, it's content, and you can use that content as much as you want, right? So that's why that is exactly why it is in the order that it is currently in, because even though the 7-day review for management of care, pharmacology, and stuff like that isn't up in there yet, it's still in the chronological order that you want to follow, right? But after you get finished with the 7-day review, or right now, the new generation NCLEX review, then you can essentially have at it, because the rest of it is content, right? So you're using content, going to and from, doing whatever you need to do in regards to doing your Q&A, right? So that was a good question, but that's exactly why the curriculum is set up that way. It's to, let you know, hey, congratulations, I'm happy that you're here. Let you know my story if you don't know me or if you don't follow me anywhere else. And then I talk about the NCLEX. Some people don't know anything about the NCLEX, which is why I talk about the NCLEX right at the beginning. Talk about NCLEX style questions. Talk about answering NCLEX style questions, critical thinking, because some people think that they could just go answer questions. like they're really black and white when they're not. They're pretty gray, and they want you to use analysis and application to answer those questions. Then we talk about the rules of taking that exam, especially if you've never taken it before. Okay. And then we jump right into the review. Getting that knowledge in there, solidifying it, repetition over and over and over and over. And then after that, you can have at it. You can literally have at it and go down and use whatever relevant content that you feel that you need. Okay. That was a good question, beautiful soul. Good question. What was the hardest point in your 4-year program? So I didn't go to a traditional 4-year program. I was active duty in the Navy. And so I did all of my prerequisites before I got into an accelerated BSN program. And then once I got into that, it was 18 months of just pure nursing. The hardest part of everything, I promise you, was time management. I felt like I didn't have time to do anything. Like I didn't even have time to sleep. It felt like, it wasn't necessarily, it was time management, and it was the lack of help that I got from the lack of, help that you get from your instructors. And I went to school online, except for clinicals, right? So the lack of help that I had, or the lack of help that you reach out for that you don't get, it was wild. It was absolutely wild. And of course, I started to blame them. And I was just like, bro, like I'm not doing well on this because I'm reaching out for help and you're not giving it to me. Or I'm reaching out for help and you're not pointing me in the right direction. And then when you do point in the right direction, you give me a YouTube channel. I'm like, bro, like I paid y'all. What you mean? You know what I mean? So, and this is where I had to realize that regardless, it's still my fault. The information is out here, so I need to go find it. And if they aren't going to help me, I need to help myself. And that's exactly what it took me a long time to figure that out. Because that's exactly what happened to me on NCLEX. I started blaming everybody else and not, pointing a finger at everybody else. But I realized I have 3 fingers looking back at me, and it's me. It's my issue. So, yes, everyone said it's self-taught, but how do you teach yourself something that you're new at? That's a great question. Same exact question that I used to ask my nursing instructors. I was just like, how in the world do I teach myself how to be a nurse if I've never been a nurse? And they were just like, oh, well, you just got to do X, Y, and Z. I'm like, okay. Just got out of school, going to finish some of your lessons, and I'll see you tomorrow. Yes, ma'am. You have a good rest of your evening. Get that knowledge in. You're going to do fine. All right. But yeah, Ernisha, for sure. I've literally heard that same exact thing. And we literally, and then you want to know what the motto is of school is nursing school doesn't teach you how to be a nurse. When you get to work, teaches you. When you start working as a nurse, that teaches you how to be a nurse. And it shouldn't be that way. But that's how it is. Their goal is to get you through nursing school. Not even prepare you for NCLEX, but get you through nursing school. Nursing school first, NCLEX second, and then after that, they don't care. So, there's that. That was a good question, though. That was a good question. What other questions do you guys have? Or Nisha, you're just answering all the questions or asking all the questions, and I'm cool with that. So I'm going to hang out here. If y'all don't got any more questions, I was going to hang out here for another about 10 minutes, but if you guys don't got any other questions, I will wrap it up first of all, you always wrap it up. Okay. Be safe out here. But I will wrap up this live. First of all, thank you all. I know those people that are not here, but thank you all for those that came to the live tonight and showed support. Hey, we at least got to 10,000 likes, and I'm very appreciative of that. But we'll be here tomorrow, 5:30, doing the damn thing. All right. Also 7-day NCLEX course. Once again, I'm going to remind everybody, 7-day NCLEX course. That link is in my bio. It is labeled 7-day NCLEX course once you hit the link tree, okay? It is going for $97. You get it for a lifetime, okay? You get it for a lifetime to include all the updates. So if you are about to start nursing school, it is perfect. One of the biggest flexes you could ever have is getting a review for $97, right? Versus how everybody else is going to get one and it's going to be on a subscription. You know what I mean? So definitely something to look into. Also, if you're looking for mentorship, if you're looking for coaching for the NCLEX or nursing in general, check out my link in my bio for coaching and mentoring, for one-on-one coaching and mentoring. Okay. So, also check out my links in my bio to Instagram. I have a YouTube. It's at The Boot Nurse. and all the lives that I do will go up on YouTube eventually. Okay. So I think I haven't uploaded in like maybe like almost probably about 4 or 5 days. So I'll make sure I get some stuff up there. All right. I'm a foreign trained nurse with over 15 years experience, including a nurse anesthetist preparing for NCLEX. Any advice? Hold up. You're foreign trained and you have experience being essentially a CRNA. I don't even you have, based off time and experience as a nurse, you have way more experience than I do, especially with doing the CRNA, the anesthesia stuff. The advice that I would tell you is everything that you've learned to unlearn it. Unlearn it, because you need to go back to the book, back to the basics type. And that is where your information to conquer NCLEX is perfect world. And it comes from that aspect of it. So everything that you've learned working in the field, hands-on, in the real world will not apply. It is what the perfect world book NCLEX National Council wants you to learn. Okay. They better jump on it. I'm trying to tell you, Lisa. I'm trying to tell you. Let them know, Lisa. Let them know what's going on out here. All right. Thank you so much. We'll get in touch. Okay, cool. Awesome. All right, ladies and gentlemen, I hope everybody has a good, fantastic rest of their evening. Like I said, go over there to those links. Check them out. We're going to be doing the same thing again tomorrow. And be kind to yourself. Be great to yourself. There's only one you. Okay. And, get your time management down and take a break sometimes. You know what I mean? But hey, don't stop pushing, especially if you're preparing for that NCLEX. That finish line is right there, and you have to push through it. Keep your pedal to the metal, keep your foot on the gas, and keep pushing. But until then, I will see everybody tomorrow. Bye.